Hello to all our listeners. I'm Isabel.
I'm Dana.
I'm Kira.
I'm Crystal.
I'm Rose.
And I'm Molly.
I hope you all have been enjoying the Healthcare and Healing podcast. We have certainly enjoyed recording it. Today, July 12th, 2021, we will be discussing the pre-pandemic intersection between healthcare and politics in each of our countries. Similarly to the United States, politicians have a prominent voice in healthcare decisions in all 6 of our assigned countries. In this episode, we will consider how politics shape healthcare and vice versa in Germany, Spain, Italy, France, Lithuania, and the United Kingdom. I hope you all enjoyed this conversation and it provokes reflection on the intersection between healthcare and politics in your own country. First off, we're going to start with the type of government in each of the countries that we were assigned and who or which party holds power. So we're going to start with Dana.
So Italy is home to a multi-party democracy. Pretty recently, actually, in 2018, a new left-wing populist party called the Five Star Movement took advantage of the growing economic unrest and rose to power. They ran on an anti-establishment, anti-vaccination, and anti-immigration platform. They recently gained the majority, like I said, and enacted serious austerity measures in the healthcare sector that were in an effort to slow the rising national debt.
Similar to Italy, Lithuania is a multi-party constitutional republic. In the beginning of the pandemic, a populist center left government was in power. However, in December 2020, that government was replaced by a liberal center-right coalition.
And similar to Lithuania, France is also a multi-party constitutional republic. France is a unitary state, so it's very centralized. It has a semi-presidential system. And France, the current president is Emmanuel Macron, who's part of La République En Marche, which is LREM. And it's a political movement, so not even a specific party, but it's a right center wing third party started from scratch that is pro-Europeanism and liberalism. And the elections in 2017 were extremely surprising, as it was the first time in the history of the Fifth Republic, which is the name of the constitutional republic, that neither of the 2 traditional major parties were in the final round.
Unlike Italy, Lithuania, and France, Spain is run by a parliamentary monarchy, and their current monarch, Felipe the Fifth, is the head of, or the fourth is the head of state and prime minister, and Pedro Sanchez is the head of government. And Pedro Sanchez is the leader of a left-leaning party in Spain called El Partido Socialista Obrero Español, which is one of many prominent Spanish political parties. And as a candidate for prime minister, Sanchez promoted issues such as economic justice and female representation in politics and unity in Spain. Some of the other prominent Spanish political parties include Partido Popular, Unidas Podemos, Ciudadanos, and Vox. And Vox is a far-right anti-immigrant political party with growing popularity in Spain, who had a very loud voice during the pandemic as well.
Similar to Spain, the UK is also a parliamentary monarchy with Queen Elizabeth II as the technical head of state and Prime Minister Boris Johnson, leader of the Conservative Party, as the actual political leader. It has multiple political parties in the system, but the conservative ones have been the main ones gaining ground in recent years, leading to Brexit, among other conservative moves such as anti-refugee policies.
So Germany is a little bit different. It's structured as a federal state and a parliamentary democracy. So the chancellor is Angela Merkel, and she's the government's most senior representative. She's a member of the Christian Democratic Union Party of Germany, and the CDU is the largest party in Bundestag, which is the German federal legislature. So it holds about like 200 out of 709 seats for the CDU, winning about 26% of votes in the 2017 election.
Perfect. Thank you guys so much for sharing the type of government that you have and who or which party holds power. Now we're going to go to the second question, which is, how popular is your leader and or party governing your country?
I can start this one off for France. So for the LREM party in France, there was a recent municipal election in 2020, right before the pandemic, which was an opportunity for a referendum on Macron, who's the president, 2 years before the next presidential election would take place. And LREM performed very poorly in this municipal election, which with a national vote share of just over 10%. Showing that LREM has failed to convert their 5 years in power at the national level into grassroots support. And it looks as though Les Republicains, which I might have butchered their party name, but they're a right-wing party in France. They have the majority of the population's favor right now, even though there was a record low turnout of voters due to COVID.
Yeah, so in relation to that, in terms of Germany, during the pandemic, the Chancellor Angela Merkel's personal approval rating actually soared. So it's over 70% kind of in recent months. And this is thanks to her handling the coronavirus pandemic pretty strongly. So starting about 50% prior to the pandemic and raising to 70% during the pandemic. And this is primarily due, I think, to her strength in response. So she has a PhD in quantum chemistry. She has a scientific background and she knows these issues pretty well. So she was able to take the pandemic really seriously at the beginning. However, while it seemed like the general population approved at the beginning, she had a lot of backlash from regional leaders. As I mentioned, this kind of ties into Germany's status as a federal state. So she had some pushback from regional leaders who were tired of pandemic protocols, who were tired of kind of lockdown for their citizens. So there are a few protests in Germany, ultimately kind of against her policies, but at the end of the day, it seems she was able to win over public favor with 70% approval rating during the pandemic.
Awesome. Thank you guys for sharing the status of the leadership in the countries. Now we're going to be talking a little bit about the healthcare budget in each of your respective countries. Crystal, do you want to start off?
Yeah, I can talk a little bit about France. So the government is responsible for regulating the healthcare budget. And the budget is funded through the national income tax, payroll tax, and as well as product taxes. And so this spending, the budget for the healthcare system accounts for 11.3% of the French GDP expenditure.
Similarly to France, Spain's Sistema Nacional de Salud, which is their public healthcare system, is primarily tax funded. And each autonomous community, which is each region in Spain, contributes its share to the national budget. And then that collected money is distributed equally to each of the autonomous communities. In 2018, 8.977% of Spain's GDP was spent on healthcare.
For Lithuania, about 50% of the budget is funded through their compulsory health insurance scheme. And the other 50% is provided by state contributions for the unemployed members of the Lithuanian people. However, Lithuania spends significantly less of their GDP on healthcare than other EU countries. As I mentioned last episode, in 2018, the EU GDP average healthcare expenditure was around 9.8%, while Lithuania's healthcare expenditure was 6.5%.
We will now be jumping to the effects of the 2008 economic crisis. So the question is, does your country still face financial deficits as a result of the 2008 economic crisis? And if so, how does this affect your country's ability to provide high quality healthcare?
For Italy, I would say for sure they are still facing the results of the economic crisis. Italy is actually around $3 trillion in debt because of what happened in 2008. They've made efforts to control this rising debt, which includes cutbacks and austerity measures, as I've mentioned a couple times before, in the healthcare sector. This includes specifically getting rid of the overstock hospital supplies and even preventing doctors and nurses from earning raises.
Yeah, Spain is definitely in the same boat as Italy. As a response to the economic crisis in 2008, Spain enacted austerity measures in 2010. And since the enactment of these measures, healthcare spending in Spain has gone down by 14%. And some Spaniards argue that the efficiency and efficacy of Spain's public health care has suffered substantially as a result of these austerity measures. And unemployment has been a serious issue in Spain as well as a result of these financial repercussions. So now we're going to talk a little bit about the individuals who are responsible for making healthcare decisions in each country. So the questions are, which individuals are responsible for making healthcare decisions? How involved are your country's politicians in healthcare decisions? And do any of them have a background in healthcare?
Speaking for Lithuania, during the pandemic, the Minister of Health was named as the head of state-level emergency operations, meaning this power granted decisions involving lockdown requirements, healthcare reorganization, testing, and more. So I would definitely say that the Minister of Health was the main decision maker. Before December 2020, Aurelius Veriga served as the Minister of Health. He did have a background in healthcare, but was trained as a psychiatrist. And then following the election, Veriga was replaced by Arūnas Dulkys, who has a doctorate in social sciences. The appointment of the Minister of Health is rather controversial because Lithuania does have a chief epidemiologist who is granted power by law. However, she was not very involved in, or not clearly involved, I would say, in the decision making. And so there was no one with really a background in epidemiology or immunology making the decisions.
In the UK, this is kind of a little different. Normally, healthcare decisions are a little separate from governmental decisions, with healthcare leaders making the final decisions regarding healthcare funding and how that's distributed, and the Prime Minister and Parliament making final political decisions. In the case of pandemic, this means lockdowns. However, during important events such as the COVID pandemic, the Scientific Advisory Group for Emergencies meets often, and it's one of the biggest factors in terms of healthcare decisions. And this group bridges the politicians and the medical leaders, leading to this combined decision-making with healthcare systems influencing how lockdowns and other pandemic restrictions were put into place.
Thanks, Rose and Molly, for your input. We're going to be finishing our conversation with the last question, which is, what was the political climate in your country in the weeks leading up to the start of the pandemic?
So the political climate in France was pretty shaky before the pandemic. 15 members of parliament left the LREM party before the pandemic started, and this was due to disagreements with the policy that was led by the government. And as I mentioned in the previous episode, public hospitals were also on strike at the time due to insufficient healthcare workers to meet patient demands, equipment decreases, as well as horrible salaries. So this all contributed to a pretty shaky political climate.
Yeah, so the UK was also in a particularly unstable situation in the months and weeks leading up to the pandemic. On January 31st, 2020, the United Kingdom left the European Union after 4 years of debate on the matter, as well as the first COVID case being discovered in the country. While Brexit later may have aided the country in terms of allowing them earlier access to the vaccine, it originally certainly added to panic regarding the new restrictions of being a non-European Union nation, with the added stress of travel bans and lack of international funding coming in and such.
Thank you all to those who listened to the entirety of the podcast. I hope you feel as though you know a bit more about German, Spanish, Italian, French, Lithuanian, and British politics and healthcare. Please listen to our next episode of Healthcare and Healing on the first wave of the pandemic. We will discuss the similarities and differences between our countries' early responses to the COVID-19 pandemic. Thank you for listening.